Thanks for doing this.
My pleasure.
Appreciate it. So to start, I just wondered if you could just tell me a little bit about your personal journey into medicine and how you first got interested in medicine. I believe Trenton, New Jersey is where it all began? Is that right?
Yes, I grew up in Trenton, New Jersey. I actually had rheumatic fever when I was in the 5th grade. Forget how old that was. But that introduced me to a doctor, Dr. Chandler, who used to come to my house once a week and see me, and also introduced me to another physician, Dr. Corrigan, who was a cardiologist. And it was through that I actually got interested in it. I was actually in bed for 5 months, couldn't go to school during that period of time, had a tutor that came in and everything. And with follow-up with him and then going down to the Children's Hospital at the University of Pennsylvania for specialized evaluations through the outpatient department, I got really interested in medicine and decided it was something I'd like to pursue. It was interesting. They didn't really do much for me. I mean, they didn't have much to do at that point in time other than to rest and watch you. But I could see that the information that they gave my parents and the solace that they gave them that I was going to be okay, that was a very helpful thing. It was sort of, I think, probably similar to what a lot of doctors do in areas of medicine that we don't have really good therapies for right now.
Again, the doctor-patient relationship, too. It seemed like that, that had a big influence on how they treated you and your parents and
yeah.
Kind of filled you in.
Yeah, it was very, very, very important. It was, I remember going over to Dr. Chandler's office, which was on the first floor of his house, that we would go in, and it would seem like we would be there for hours, and so would a lot of other people that were there. He was very dedicated, and it made me start thinking what the family life was like that he had, which was not probably a lot at that point in time because of his involvement with his patients. But it was something that gave us a lot of security and feeling good about what was going to happen to me.
I understand you went to some parochial school growing up.
I went to St. Ambrose, St. Raphael's. It was Sister Ambrose that I had back at that point in time, and having going to a parochial school was a very interesting experience, especially with the nuns that stood me in good service throughout my life. Got used to corporal punishment as a way of motivating you to do things, and it was very interesting and very good for me.
You mentioned the nuns, but were there any teachers or mentors that really had a big impact on you?
Oh, yeah, absolutely. I'm sure as probably everybody has experiences like this. It was more in my high school that I remember that. Well, I remember there were, the nun that I mentioned, Sister Ambrose, who was actually the principal of that school, but was a very hard taskmaster, but did it with sort of a difficult, tough love type of thing. She taught you the value of pursuing a goal that you had and how you had to really work for it. I think my dad taught me a lot of that as well. My dad, came out of high school during the Depression. He really wanted to be an engineer, but his family couldn't send him to college at that point. So he took up the trade that his father had, which was a baker. He was a very good baker, and he actually, my brother, my uncle, my grandfather, myself all worked in the bakery with him, including my mother, my aunts, and the like who were there. So it was, again, he taught the value of hard work and pursuing things. In high school, I won a scholarship in high school, sort of like a competition between the nuns to see who from their school could win this scholarship to St. Joe's Prep in Philadelphia. It was a Jesuit school. The Jesuits were an order that were teachers and missionaries that they had, and but a number of the actual priests that were teachers, but also some of the lay people. I remember Charlie Barton was a fellow who taught history, and I hated history. don't tell anybody in the Osler Society this, but history was not my big love at that point in time. And I really did not really get really into history again until I really got involved in medicine and looking at the history of medicine and things that have evolved over the period of time that I've been in medicine. But Barton Earl Hart was a mathematician, really inspired you to really do difficult mathematics and really saw the beauty of thinking and solving problems and everything for us. So there's a lot of that. That was in high school, and obviously in college and medical school, the same thing occurred.
And any other physicians or anything in your family before?
No, I was the first one to go to college in my family. My brother was the second. You know, it was a big deal for my parents. You know, that was something that was really special. It was, you know, I could tell my parents were really pushing for that. It was really interesting. The day that my brother graduated from college, my father sold the bakery. Yeah, because he really had it to put us through school. And he and my mom ended up getting a motel down the Jersey Shore because that's what they really wanted to do for all this time. But they could send their sons through college by something that was a little bit more secure and in greater need by people.
And when did you first become aware of William Osler and then later the society?
Well, I'd heard of Osler before, and obviously I did my oncology training at Hopkins. It was hard not to know about Osler if you're at Hopkins. You know, he had his office there. He was the first head of medicine there, and it imbued the whole institution that we were there. I really didn't get into him and what he stood for and how he lived his life until being involved in the Osler Society, which, you know, your dad invited me to come to a meeting. I just loved it. I mean, it's sort of like auditing a very interesting college course, not having to take an exam in it, you know, which was great. I mean, it's really interesting because the history is something that I always talk to a lot of the interns, residents, and medical students now, because, you know, when they come into medicine, they think it's always been that way all the way. And if you go and tell them some stories that, you know, like I didn't have CAT scans when I started out and how that developed and everything and what it meant for the whole practice of medicine was just monumental, you know, to see that.
And you touched on it, but at that first meeting when you came, what was it that really captured your imagination?
Well, some of the diversity of papers. I remember one paper, and I can't remember who gave it now, but it was about Reverend Graham and his health biscuit. And this is the one that really hit me because do you know who Reverend Graham was and what his health biscuit was?
I do not.
So he was a minister who proselytized around England, but he also was into health and sold this biscuit. And the biscuit turned out to be the beginning of the graham cracker. So this sort of very almost ludicrous type of thing that came out of the paper was something that really turned me on. And then I can remember just different stories of when we were over in Scotland and to hear the stories of Lister and to see his lab over there and, you know, to learn all about oxygenation and everything that was going over there. It was impressive. I really got interested because the medical school that I went to, University of Pennsylvania, was the first medical school in the United States. And it also had a lot of meeting when we were over in Edinburgh because almost all the medical schools that were south of New York had their beginnings from people that were in Edinburgh. And this idea of how these four professors that came over and started this school, how they influenced the development of medicine throughout the whole United States, just really turned me on. I mean, you can't help but just look through these through the papers that are being presented and just see things that are going to be extremely interesting, that you'll learn things that you never were thinking about, and it gets you thinking in a different way.
And why do you think it's important for medical students and young physicians to know about Osler?
Well, I think he's a person, a physician, a man who gave us an example to live by. And he gave us an example. I mean, actually, Osler, during his time, basically the major things that he had was talking to people, examining people, thinking about it, trying to solve problems. In our day now, we have so many competing forces that are taking the patient out of the whole picture of medicine. I see interns, residents, other physicians who are more interested in looking at a scan or seeing what a cardiac test has shown them or what a lab test has shown them, and think that they really know what's going on without really listening to what the person's telling you and how it impacts their life. You need both. I mean, I'm not downplaying those tests at all, and I think that in some ways those tests are very important for the people's diagnosis, like what's going on. The other thing that I see is we have so many other influences outside of medicine that are influencing medicine now. Medicine's a very large business. I think we in the Osler Society don't think of medicine as a business, but it clearly is. And I think we have to think about it to realize that this is a force that's going to be changing things from the way we really want to practice and the way Osler practiced. And, I think you have to, and we have the danger of relying so much on what Osler did to think that that's the only way and the right way. I don't think we're doing that, but you certainly can fall into that trap easily. And you have to think about what would Osler do to adapt these other outside influences into the practice of medicine.
Exactly. And it seemed in his time, he was always looking at, new, whether it's new treatments or technologies, but he seems like, who knows how it would be if he were here now, but that he would find a way to adapt.
I'm sure he would. I mean, as president of the Osler Society, I have to say that, but I'm sure that that's probably the case. I mean, what he did with microscopy, and how he brought that into clinical use, I mean, that was a brand new field. That was the same as the scans that we have now, or PET scans or so that we have. He's just an amazing person. He really gave us a way to think about medicine, practice medicine, and he also had a life outside of medicine that is important for all of us. And I'm not the greatest person to emulate that, because I think a lot of physicians get to be very one-sided, but he had other interests which were important.
What would you consider Osler's biggest contribution? There were many, but to you, what stands out the most?
Well, obviously, his textbook of medicine that gave somebody a way to think about disease and learn about disease was a monumental undertaking. But he also gave us a way of life. He had a very structured way of life, how he read, how he collected books, how he spent time with patients, how much time he allowed to do different things, how he made time to write things and the like, It's interesting. I think his life was, his world at that time was tremendously different than our world right now. I'm sure that he wrote a lot because he probably spent a lot of time on ships and planes and trains. I mean, not planes, but trains and ships where he had a lot of time where he could write. That doesn't happen now. I mean, it seems like our world is so busy that if we don't follow his dictums to set time aside to do things, they don't get done.
And as far as your presidency, like you said, you were invited to a meeting, you came here, you kind of found out what it was all about. I don't know if at the time you imagined yourself as president of the society, but when that came to pass and with your peers wanting you to become president, how did that feel to you?
Well, I mean, to be very honest with you, it was a great honor. But it was one I really thought that I might not take, just because I'm not very good at time management, like Osler was saying. And I was very busy, and I wasn't sure that I could really spend the time that needed to be spent for this. But I realized that with the honor of it and what it meant, that it was something that I should take. And fortunately, the things that I dreaded the most doing, that is writing the 4 Oslerian articles and putting together a president's address, are the things I've enjoyed the most out of this, because it's sort of given me a bully pulpit to talk about things that I'm really interested in and that have application to our members.
You know, we're back at a meeting and we're all together. We've been through, everyone has been
That's
through
right.
quite an ordeal in the last couple of years, and we had to have our meeting virtually last year. Can you talk a little bit about how that experience, affected you, but also in terms of the society and having to adapt to doing some things online?
Yeah. So we actually haven't started our meeting yet. This is tonight we officially start it, and but just the joy and the idea of having people in the same room. I mean, one thing that's very important in medicine is the camaraderie amongst the people that you practice with, see patients with, that you associate with in societies. And I'm going to talk a little bit about this in my presidential address, but I can see the joy around this place of people just being in the same room, not having seen anybody for the past 2 years. I feel lucky that I'm the president when we're having a real meeting. I mean, my hats are off to Mario Molina, who had his presidency in the first year, never ever gave a presidential address, and also to Mike Jones, who did an amazing job of trying to really put down rules and ways that we can make the society better. But again, did everything virtually. And, the fact that we had to do things virtually have changed our whole society in a way, somewhat for the better, I think. But it also made us appreciate that there's something really lost when you can't be in the same room with somebody.
Absolutely.
Yeah.
How do you think Osler would have handled the global pandemic?
Well, it's interesting because he was probably part of the global pandemic of 1918, a year before he died. And I don't know exactly how he did that. I mean, at that point in time, he probably would have handled it emotionally probably better than we did, because we're always sure he can do things better than we did it. But, I mean, from a medical point of view, he was really strapped. I mean, they didn't have, the ability to put vaccines together the way we did. I mean, they had, having grown up in the Philadelphia area, I have grandparents who told me about, remember people putting bodies out on the street to be picked up and everything. Similar to, I guess, what happened in New York, where they had to refrigerate people in trucks and with what was going on. But I'm sure he would have done it with grace, giving people some solace, helping families through things and But I think he would have been strapped to do anything medically of great importance. Another
thing that's so identified with Osler is equanimity and the idea of equanimity and equanimitas. Can you speak a little bit to what that means to you in terms of Osler or beyond?
Yeah, I think it means a levelness of thought, a fairness of thought, dealing with people in a righteous and constant manner, no matter what their background is, with your colleagues in the same way, and just trying to make the place better through a civil way of dealing with people and trying to help them with everything.
Like you were talking about the challenges today, where the patient sometimes gets lost, and medicine has become such a business. What do you think? I know this is a big topic, but what do you think should be some of the changes for delivering healthcare in the best way?
Well, I think it's going to be a very, very difficult thing to bring. And I don't think our system was perfect before we had all these by any means. And in some ways, the fact that we have, different businesses involved and the like, maybe for the good of medicine because it's pointing out the shortcomings that we have. But I think we need to stand up and recognize things that may really be pointing out inequality in our system and how we can potentially make it better. You know, we have a wonderful healthcare system if you happen to be rich or have really good insurance. If you don't, we have a horrible healthcare system. You know, I'm in oncology, and when we look at the price of our drugs, it's out of sight. It's, I think, unethical and the like. And we have to speak up about that. We have to get pharma involved in a conversation. Pharma's not involved in a conversation. I mean, they're a business. Their bottom line, yes, they're interested in people and they want to make good drugs. But you know, I deal in an area that has some very rare diseases in it, and it's tough getting them to really get involved with trying to get a medicine on board that's going to help a relatively small group of people. Now, they're really priced very high, and they can make money off of it, but it's not the same as making a medicine for hypertension or diabetes or something like that that you look at. We have to look at a better way of how we develop certain things. The other thing is, I mean, this is a dirty word to say, I'm sure, but perhaps a common health insurance, could help people out a lot. Now, it's not going to allow us to do some of the really sort of neat and cool things that we're seeing, you know, like maybe CAR T-cell work and like to the same degree that we have, but will help more people out. You know, it's really hard when we spend so much money on one area of medicine that takes away from being able to afford to give vaccinations to kids in countries that are not as wealthy as we are. Like, I mean, we have to look at fairness, I think, which we're not looking at right now. We give lip service to a lot of things. You know, the patient is at the center of all things, but it's probably not really true. Patient's at the center of all things if it also matches up with the goal of what I want to accomplish out of something as well.
Do you see like universal health care happening in this country?
Ooh, I'm not sure what I see happening in this country now with what's going on. I mean, watching what's happening in our government right now is a disparaging exercise. You know, we can't get people to really think. I mean, why should you have on a question everybody in one party voting one way and everybody in another party voting the other way? It means somebody's not thinking someplace along the line. And, you know, we need some major changes in many different areas, you know.
And with all the changes and the challenges that exist in medicine, what do you think can be done to keep medical school applicants at a high level so it doesn't start really affecting?
Well, I think medical school applicants are at a very high level right now, because I think that the people that are being attracted into medicine are being attracted into it for the reasons that most people go into medicine. You know, medicine is a field that you can make a comfortable living. You know, you can provide for your family, but it's not the field. You know, if you want to become a millionaire, it's not where you go in. It's not what you do. I mean, there's other ways of making more money. I don't think we have people that go into medicine, or rarely go into medicine just for the money, for the financial gain from it.
And if there was a medical student or a young physician who maybe had heard a little bit about the Osler Society and was still trying to figure it all out, what would you tell that person if he or she were kind of on the fence about, I don't know if I want to join or not?
Come to a meeting, see what they present, see what they talk about. Talk to the people in the breakout sessions afterwards. Not the breakout sessions, but the breaks. Meet some of the people, see what motivates them. You know, learn a little bit about how your profession that you're thinking about really started and how it developed, and how we dealt with it as a society.
Great. And you touched on some of the teachers and mentors that had a big effect in you growing up and in your education. And there were certain papers that really stuck out, or anything else that you can think of from the meetings or special meeting, or?
Well, I know it's very hard, and it's hard for me saying this and to really single somebody out, because I'll leave other people behind with it, like, as well. But I mean, there are people in this society. I mean, I'll say a few. I mean, I think Charlie Bryant is an amazing, amazing individual. Charlie, he's accomplished a lot in his life. He is a buzzsaw when it comes to putting out articles and writing about things, and his love for Osler and his dedication to it, and doing things that he's not getting paid for, but he's just doing it for the advantage of everybody else that's here. They're just amazing people I've met along the way who just have a love for this.
For you personally, what has been the best part about being in the society, and also as being president this past year?
Well, the best part of being in this society is really the people that I meet, exchange of ideas, and a real interest in people that we take care of. The best part of it this year for me, again, has been having to deal with with people throughout it, and getting the meetings started again. But really the thing that I really hated, which I thought I was going to hate, turned out to be the best thing, and that is writing the articles for the Oslerian and putting together thoughts for a presidential address. We'll see how well the presidential address goes, because that's not till tomorrow. We'll see. But anyhow, that's been fun, because it's forced me to sit down. I'm pretty easy to go on to something that's going to be a little bit easier for me to accomplish more. But when you have to sit down and write something, it really makes you think about things more. And that was really invaluable to me. I mean, a lot of what we're talking about right now came out of my thinking about some of these that we see. One thing, we're here in Galveston. Galveston has a large Osler Society of their own with younger people in it. I'm glad to see that we're getting a lot of younger people into the society, because, I mean, young people are great. They ask questions that we don't know the answers to, but we have to think about. Plus, they have a lot of insights of their own of what things should be. Okay, and I think we need to get many more young people into it, but keep the older guys like myself as well. But until we go by and by. But anyhow, that's very, very important.